Okay, so for today, I'm going to be teaching Edith, she's one of my peers, how to check her glucose using a glucose monitor or a glucose meter. We're going to start off by washing our hands or using hand sanitizer. So I'm going to do that first. Okay, and after that, we're going to gather all of our supplies. So I have here a cotton ball, an alcohol pad, a lancet, and a Band-Aid. And I also have my gloves that I'll be using and my glucose monitor with my test strips. Okay, all right, so I'm gonna apply my gloves. Before I start, I just kind of wanted to give her some education on how many times a day she should be checking her blood sugar. So you should be checking your blood sugars 4 times a day. So in the morning, fasting, and then after breakfast, after lunch, and then after dinner. So that's 4 times. Whenever you have any hypoglycemia episodes, that means that you feel like your blood sugar is low, or hyperglycemia, that means that your blood sugar is high. We want you to also check your blood sugar, so just so we know what it's at. So if it comes back that it's too low, we want you to either chew some candy or suck on some candy, drink a little bit of either soda or a little bit of apple juice, something that'll help bring your blood sugar back up. And then we want you to recheck again in 15 minutes just to make sure it's back up to where it should be. Whenever your blood sugar is too high, we also want you to check your blood sugar. And if it's too high, sometimes you are able to inject a little bit of insulin, or if it's just too high, we want you to call your doctor and let them know to see what directives they give you. Okay? All right, so I have all my supplies here. We're gonna be checking your blood glucose today. So let me get my stuff ready here. So you wanna grab your machine, your meter. Then you wanna grab one of your test strips. Okay, so here I'm ready to poke my patient. So I'm gonna show her how to use the glucose meter. So you'll grab your strip and you'll put this part in like this. And you'll see that your meter is turned on here. So the meter is turned on here. You'll see a little drop right there. That means it's ready for the blood to go in the little strip. Okay, I'm gonna wipe my patient's finger. Use my cotton ball. So sometimes your glucose meters, usually most of the time they come with this device to poke, and then they come with another like little needle that you'll put inside, and then you just press this button and it'll help you poke. But today I actually have one of these nicer lancets. Just gonna, that I'll use. It's kind of just like a push lancet. Okay, so I like to go more to the side of the finger, because if you do on top, a lot of patients say that hurts a little bit more. So I'm gonna do here, poke, and there it is. You wanna wipe the first drop of blood and kind of like push on your finger and get a good drop. And then this little line that's right here, you wanna put your drop of blood in it, just like so. Like that. And then on here it's loading. Just putting the blood here. And your blood sugar is 109, so that's pretty good. So you always want your blood sugar to be about in between 80 to 120, okay? Usually, I did want to mention that when you start feeling like clammy, blurred vision, kind of sweaty, kind of anxious as well, that sometimes means that your blood sugar is low. The hyperglycemia, when your blood sugar is high, has some of similar symptoms. So again, I just recommend that you check your blood sugar. Depending on your number, you'll see what you have to do. Either have something to drink or a candy, or maybe you need to inject some insulin to help lower those blood sugars, okay? All right. Can you tell me how many times you're going to be checking a day?
4 times a day.
Okay, unless you have symptoms, then you'll check again.
Check again.
And then you'll poke, check, and then check again. How long?
15 minutes.
Perfect, okay. And then you know that to turn on your glucose monitor, you have to put your what in?
Strip in them.
Yep. All right. And then I also recommend that you grab a log and then log all your blood sugars. Usually there's one in here that comes with your glucose meter that you can use to like log all your blood sugars before breakfast, fasting, after breakfast, all of that, and then bring it to your next appointment with your provider. Okay? Do you have any questions?
No.
All right, and then anything with blood you can put in the little biohazard bin in your lancets as well, and then everything else can go in your trash. All right.